This flu season is, by and large, less severe than it was last year. That being said, last year was amongst the most severe influenza seasons we've seen in a long, long time. In general, seasonal epidemics caused by H1N1 strains are less severe than seasonal epidemics caused by H3N2 strains. Last year, the predominant strain was an H3N2 strain. This year, the predominant strain through most of the country is an H1N1 strain. However, in parts of the southeast of the United States, the predominant strain seems to be an H3N2 strain that only about 70% of those strains are well matched to the vaccine strain. And so depending on which part of the country you're living in, some people are seeing a fairly mild influenza epidemic, whereas some are seeing a little bit more severe. Even if the epidemic overall is more mild than it was last year, when you get it, it still feels pretty bad, and we will still see increased deaths in older adults and those with underlying medical conditions, as well as children. The best thing to do is to get vaccinated. If you haven't gotten vaccinated yet, I encourage people to do so. What we know is that although the vaccine is not 100% efficacious, somewhere between 30 and 60% depending on the strain, the vaccine does prevent severe outcomes. We know that kids who have gotten vaccinated who get influenza anyway are far less likely to die. And we know that older adults who get the vaccine and get infected anyway are far less likely to have hospitalization or complications thereof.